Hi everyone, welcome to another video of NS Pharma. In today's video, we are going to study 20 important multiple choice questions. These questions are very important for the pharmacist competitive exams like government pharmacist exam, Gpat, Niper, drug inspector, and also for the PROMETRIC exams of different countries. I also included some previous year exam questions in this, so try to do all the 20 questions and comment your score below. If you didn't subscribe until now my channel, please subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. Let's begin. The first question is, the Poisons Act was passed in the year. The Poisons Act was passed in the year. Options are, option A, 1857, option B, 1919, option C, 1940, option D, 1971. So we have got four options. The question was, the Poisons Act was passed in the year. The correct answer for this question is 1919. The Poisons Act was passed in the year 1919. So what is the Poisons Act? The Poisons Act was introduced to control the import, possession and sale of poisons. Next question. Question number 2. Colchicine is used mainly to treat. Colchicine is used mainly to treat. Options are, option A, cancer, option B, rheumatoid arthritis, option C, gout, option D, diabetes. So colchicine is used to treat. The correct answer for this question is option C, gout. Colchicine is used for the treatment of gout. The drugs for the treatment of gout is classified into two main categories, that is, drugs which used for the treatment of acute gout and the drugs which is used for the chronic treatment of chronic gout. Before that, what is gout? Gout is a severe pain in the joints because of the accumulation or high value of uric acid in the blood. That is the gout. It is the severe pain in the joints due to the high level of uric acid in the blood. The drugs against gout is classified into two categories, that is for acute gout and also for chronic gout or hyperuricemia. For the acute gout, the drugs used are NSAIDs and also colchicine. Here colchicine is coming. So for the chronic gout, it is again classified into two, that is uricosurics and synthesis inhibitors. Uricosurics are, they will promote the excretion of uric acid in the urine. That is the mechanism of action of uricosurics. So what are the drugs coming under uricosurics? The drugs coming under this category is probenecid and sulfenpyrazole. Now the next category, that is synthesis inhibitors. The drugs coming under synthesis inhibitors are allopurinol and febuxostat. These are the two medicines which is coming under synthesis inhibitors. So we are moving to the next question. Question number 3. Betadine contains, options are gentian violet, option B beta-methionine, option C benzocaine, option D povidone iodine. This is a simple question. Betadine contain. We know that betadine contains option D, povidone iodine. That is the correct answer. Now we will move to the next question. Question number 4. Egg yolk is used as. Egg yolk is used as. Options are suspending agent, option B emulsifying agent, option C binder, option D preservatives. The correct answer for this question, that is egg yolk is used as emulsifying agent. Option B is the correct answer. Okay. Now we will move to the next question. Question number 5. We have to complete 20 questions. So the fifth question is, high technology medical development exists in. High technology medical developments exist in. Options are budget hospital, option B elite hospital, option C medium hospital, option D cancer hospital. In which hospital we can find high technology medical equipment or medical developments? The correct answer for this question is elite hospital. Option B, elite hospital. Budget hospitals are those hospitals. In this, we cannot find that much type of high technology medical equipment. They are using normal technology, normal equipment only. The cost of treatment will be less comparative to the elite hospital. Cancer hospitals are specialized for the treatment of cancer. Now we will move to the next question, question number 6. Potent loop diuretic is. Potent loop diuretic is. Options are furosemide, option B mannitol, option C acid drugs, option D acetazolamide. These are the options. The question is potent loop diuretic. This question is from pharmacology. We know that diuretics are classified into 3 main categories. One is high efficacy diuretics. The mechanism of action of these diuretics are inhibition of sodium potassium chloride co-transport. That is the mechanism behind the action of high efficacy diuretics. Example for this category are furosemide, bumetanide and torsemide. Okay, this is the high ceiling diuretic or high efficacy diuretics. This is also called potent loop diuretic. They are potent, they are acting on loop of Henle. That's why they called loop diuretic. The next category of diuretics, we studied first class of diuretic, that is high efficacy diuretic. Next one is medium efficacy diuretics. They will act based on the inhibition of sodium potassium transport or symbiote. Sodium potassium symbiote. Okay, this is the mechanism of action of medium efficacy diuretics. The example for these types are thiazides. Example for thiazide diuretics is hydrochlorothiazide. That is one of the good example for this thiazide diuretics. Hydrochlorothiazide is coming under the brand name acid drugs. In the option, it was the option C, acid drugs. That is hydrochlorothiazide. Okay, that is a medium efficacy diuretic. Some other drugs are also coming under this one. We are focusing on just for the classification. Now the third category is weak diuretic. Weak diuretics or adjunctive diuretics. This weak diuretics is of 3 types. That is carbonic anhydrase inhibitor, potassium sparing diuretics and osmotic diuretics. These are the 3 types of weak diuretics. We already covered some important points regarding this weak diuretics in the previous video. I will paste the link for the previous video. You can watch it if you didn't watch until now. So the answer for this question, that is question number 6, potent loop diuretics is, correct answer is furosemide. Option A, furosemide is the correct answer. Now we are going to the next question, question number 7. Question number 7 is fractional distillation is carried out for. Fractional distillation is carried out for. Options are miscible liquids, option B immiscible liquids, option C volatile oils, option D fixed oil. Okay, these are the different options. The question is fractional distillation is carried out for. Before going into the answer, what is distillation? Distillation is a process of separation of a mixture of liquid. That is called distillation. So distillation is classified into 4 categories. There are 4 types of distillation. One is simple distillation, the second one is fractional distillation, the third one steam distillation, and the last one is destructive distillation. These are the 4 different types of distillation. What are them? Simple distillation, fractional distillation, steam distillation and destructive distillation. In the question we are asked about the fractional distillation. We have to study the main difference between simple distillation and fractional distillation. Both are useful for the miscible liquid. Both are useful for the separation of miscible liquids, but there is a big difference in between them. That is, in simple distillation, we can separate the mixture of liquid, but there should be a big difference in the boiling point of these liquids. That is, minimum of above 25 degrees Celsius. If the component of liquid mixture don't have the difference of a boiling point of 25 degrees Celsius, then we have to use fractional distillation. That is, in case of fractional distillation, we can separate the mixture of miscible liquids for which the difference in the boiling point is less than 25 degrees Celsius. We are using steam distillation for the separation of volatile oil mixture. Okay, now we are moving to the next question, question number 8. Before that, we will say the answer. Fractional distillation is carried out for option A is the correct answer, miscible liquids. Now we are moving to the next question, question number 8. That is, sodium metal is stored in. We know that sodium is a highly reactive metal. So the option we can see, option A water, option B alcohol, option C kerosene, option D either. Okay, sodium metal is stored in. The correct answer, since the metal sodium is highly reactive, we should keep the sodium metal in kerosene. We should keep sodium metal in kerosene. Now we are moving to the question number 9. That is, purified water should have a pH between. What is the pH of purified water? Options are option A 3.5 to 4.5, option B 4.5 to 7.5, option C 8.5 to 9.5, and the last option 2.5 to 3.5. The correct answer for this question, that is, purified water should have a pH between 4.5 to 7.5. 4.5 to 7.5. That is, option B is the correct answer. Now we will move to question number 10. Vitamin containing drug. Vitamin containing drug. Options are shark liver oil, option B castor oil, option C beeswax, and option D cholmogra oil. What was the question? Vitamin containing drug. Okay. Options shark liver oil, castor oil, beeswax, and cholmogra oil. The correct answer for this question is option A shark liver oil. Shark liver oil is the correct answer here. Even if it is cod liver oil also, you have to write cod liver oil. If there is no shark liver oil, and in that place if it is cod liver oil, you can write cod liver oil as the answer. Okay, but one important thing in this option, there is cholmogra oil. Cholmogra oil, regarding cholmogra oil, there is a one important point. It is also called hypnocarpus oil. Okay, cholmogra oil is also called hypnocarpus oil. This oil is used for the treatment of leprosy and tuberculosis. Many question paper already asked these questions, so you have to by heart this one. The oil or the drug which is used against or for the treatment of leprosy and tuberculosis is cholmogra oil. Cholmogra oil or hypnocarpus oil. Now we will move to the next question. Question number 11. Atropine is present in. Atropine is present in. Options are phenyl, option B clove, option C calmette, option D belladonna. This is a simple question. Atropine is present in. Option D belladonna is the correct answer. Belladonna is, what is belladonna? What is the biological source of belladonna? Belladonna is the leaves, dried leaves and aerial parts of the plant Atropa belladonna belonging to the family Solanaceae. Okay, it is the dried leaves and aerial parts of Atropa belladonna belonging to the family Solanaceae. They contain propane alkaloids. Okay, now we will move to the next question. Question number 12. That is, Commiphora vitae is the botanical name for. Commiphora vitae is the botanical name for. Options are Google, option B cardamom, option C nutmeg, option D fennel. Commiphora vitae or Commiphora mughal. The drug is Google. Correct answer is option A Google. Okay. So here the question, Commiphora vitae is the botanical name for Google. Okay. Now we will move to the next question. Before that, it's the family of Google is, or Commiphora vitae or Commiphora mughal is Burseraceae. Burseraceae, it is the oleogum resin obtained from these plants. It belongs to the family Burseraceae. Now we will move to the next question. Question number 13. The major protein of the connective tissue is called. What is the major protein of connective tissue? Options are keratin, option B collagen, option C myosin, option D melanin. Okay, there are four options, that is keratin, collagen, myosin, melanin. Okay, the major protein of connective tissue. The correct answer for this question is option B, collagen. Collagen is the major protein of connective tissue. Not at all the connective tissue, it is the major protein present in our body. The most abundant type of tissue in the body is connective tissue. Okay, what is connective tissue? It is the most abundant type of body tissue is connective tissue, and the major protein present in the connective tissue or the major protein present in our body is collagen. Now we will move to the next question, question number 14. Question number 14 is the universal donor of blood group. The universal donor of blood group is, options are A, option B, B, then option C, AB blood group, option D, O blood group. The correct answer, that is asked for the universal donor. The universal donor is O. If we are specifically we are saying, then the universal donor is O negative. O negative blood group is known as universal donor. Who is the universal acceptor of blood group? That is AB positive. AB positive is the AB positive blood group persons are the universal acceptor. Okay, now we are moving to the next question, question number 15. The ratio of oil, water, gum used for the preparation of primary emulsion of a fixed oil. For the fixed oil, we are talking about the fixed oil. The ratio of oil, water, gum used for the primary emulsion of a fixed oil. Options are 4:4:2. Option B, 1:2:4. Option C, 2:4:4. Option D, 4:2:1. Which is the correct answer? The ratio of oil, water, gum used for the primary emulsion of a fixed oil. The correct answer for this question is 4:2:1. That is option D is the correct answer. We should study some important points regarding this one. That is, now the question was about fixed oil, for the primary emulsion of a fixed oil. What about the preparation of a primary emulsion of a mineral oil? What is the ratio of oil is to water is to gum? In case of mineral oil, the ratio of oil, water, gum is 3:2:1. Okay, 3:2:1 is the ratio of oil, water, gum used for the primary emulsion of a mineral oil. What about volatile oil? The volatile oil ratio is 2:2:1. If we are generally speaking, the ratio should be 2:2:1. The ratio of oil, water, gum. Okay, you have to, when you are writing the answer, you have to check the question correctly, because maybe they will change the order, that is oil, water, gum, they will change to oil, gum, water. At that time, the automatically the answer also will change. Okay, you have to study this one very well. This is also one of the important question. Now we are moving to the question number 16. That is the hemoglobin, or each hemoglobin molecule contain 4 atoms of, this is a simple question, for each hemoglobin molecule contain 4 atoms of. Options are iron, option B copper, option C manganese, and option D magnesium. Each hemoglobin molecule contain 4 atoms of. The correct answer is iron. Hemoglobin molecule is made up of 4 subunit. Okay, 2 alpha subunit and 2 beta subunit. Each subunit contain a heme protein. This heme contain iron molecule. Okay, so each heme protein or each heme can bound with one oxygen molecule. So there are 4 subunits. That's why there are 4 heme protein. So one hemoglobin molecule can carry 4 oxygen molecule. Hope you understood this one. One more time I will repeat. One hemoglobin is composed of 4 subunits, 2 alpha subunit and 2 beta subunit. Each subunit contain one heme. This heme contain this iron. Okay, each heme can bind with one oxygen molecule. So there are total 4 subunits. There are 4 heme. So they can bind with 4 oxygen molecule. That is, one hemoglobin molecule can bind with 4 oxygen molecule. Now we are moving to the next question, question number 17. A grain is equivalent to. A grain, that is 1 grain is equivalent to. Options are 70.8 milligram, option B 60.8 milligram, option C 64.8 milligram, and the last option, that is 43.8 milligram. Okay, a grain is equivalent to. This is one of the important area where the questions are coming. So based upon the pharmaceutics calculation, many questions are there in the competitive exam, so you have to study this topic very well. So in this, the correct answer, that is 1 grain is equivalent to 64.8 milligram. 1 grain is equivalent to 64.8 milligram. We know that there are avoid-poise system and also apothecary system for the measuring. According to avoid-poise system, 1 pound is equal to 7,000 grain. Okay, according to avoid-poise, 1 grain is equal to 7,000 grain. What about apothecary system? According to apothecary system, 1 pound is equal to 5,760 grain. Okay, 1 pound is equal to 1 pound of apothecary is equal to 5,760 grain. This is also one important point regarding this grain. Okay, now we are moving to the next question. One more time I will repeat that 1 grain is equal to 64.8 milligram. Next question is, INH is used in the treatment of. INH in the short we will write for the drug isoniazid. Isoniazid is used for the treatment of. Options are tuberculosis, option B leprosy, option C amoebiasis, and the last option cancer. So for which disease INH or isoniazid is used? The correct answer for this is option A, tuberculosis. Isoniazid is used for the treatment of tuberculosis. This isoniazid is one of the first line drug used against the tuberculosis. There are other drugs also that is using as a first line drug against tuberculosis. What are them? The first one I told, isoniazid. Then next one, rifampin. Then pyrozinamide. Then ethambutol. Then the last one is streptomycin. There are 5 first line drugs against tuberculosis. What are them? Isoniazid, rifampin, then pyrozinamide, then ethambutol, and the last one is streptomycin. These are the first line drugs used against the tuberculosis. Next question, question number 19. The animal used for the pyrogen test. Animal which is used for the pyrogen test. Options are calf, option B rabbit, option C horse, and the last option is sheep. The animal which is used for pyrogen testing. The correct answer here is rabbit. Option B rabbit is the correct answer. Pyrogen test is actually performed to check the presence or absence of the pyrogen in the parenteral solution. We are using this pyrogen test normally for the presence, for finding the presence or absence of pyrogens in the parenteral solution. If there is a pyrogen in the parenteral solution, the body temperature of this rabbit will rise it up. Okay, now we are going to the next question. The last question of the video. Imipramine is used as. Imipramine is used as. Options are tranquilizer, anticonvulsant, antidepressant, and the last option is analeptic. So the question is, imipramine is used for the treatment of, or it's used as tranquilizer, anticonvulsant, antidepressant, and option D, analeptic. The correct answer for this question is antidepressant. Imipramine is an antidepressant drug. It is coming under class tricyclic antidepressant, that is TCA. Thank you very much for watching this video. We will come with the next part soon. Before leaving, if you didn't subscribe until now my channel, kindly subscribe the channel and also press the bell button. And one more thing, don't forget to share this video with your pharma friends so that they will get also benefit. Thank you.